Well, there's a common perception that Arkansas prisons may be full of many nonviolent drug offenders. They take up bed space for more violent criminals, and something should be done about it. At least that's the perception. But what does the data tell us? KATV's Janelle Lilley joins us. She's been reporting on this. Janelle.
Well, Roby, as you know, the governor created a task force back in 2015 to study this issue, overcrowding, the issue of parole, prison sentencing. So they met this past week, and a group of prosecutors presented them with the data that they say tells a different story.
Unless your family's been directly affected, you probably don't give too much thought to who gets put behind these bars. But prosecutors do.
There's a narrative out there that, we've got too many 16-year-olds in prison that are there for smoking pot. And Janelle, that's just not the case.
In Arkansas, the prison population looks like this. Homicide, sexual offenses, and violent criminals make up more than half. Less than 500 people are in prison for possession.
Even that 2%, you have to ask yourself how many of those pled down from delivery or manufacturing.
Highland says the numbers don't lie, but the idea that overcrowded Arkansas prisons are filled up with drug addicts is untrue. He and 27 other prosecutors have banded together to fight parole reform.
So if you have somebody that commits sexual assault and they get 20 years, they're out in 5 years. And so people assume that if they commit another felony, they're going to go back and serve the remainder of their 15. And that's just not happening. They go back and serve 6 to 9 months of TVP and they're done.
Highland worries reforming parole would make that problem even worse, pointing to Arkansas's 77% recidivism rate and national statistics that show about half of crimes committed are committed by repeat offenders. Highland argues if we keep them in prison, crime will drop. But Arkansas prisons are already crowded. The state would have to spend more money to build more. And that may be a tough sell.
So, Janelle, I guess that kind of leads to the question, can sentencing reform really ease this overcrowding problem?
Well, and you know what? That is exactly what the prosecutors are telling the panel that they don't want. They don't believe sentencing reform is necessary. They say that the sentencing guidelines have been consistent over the last 3 years, that reforming that wouldn't ease the population. In fact, they believe that the people who are in jail actually do need to be in prison at that time. They're saying less than 36% of convictions actually go to prison.
And so there has been some polling data that goes along with this that the prosecutors got behind that basically shows the public what?
They support the prosecutors in this, according to the prosecutors' polling data. Now, we don't have all of the details on who this is, but the breakdown's about 50-50 for men and women. And it's very overwhelming, more than 80% on most of them. And as you can see, the prison population right now in Arkansas, less than 500 people are in prison for what we think of most people being in prison for possession of paraphernalia or possession of narcotics.
These are hardened criminals that are in there. And really the kind of key now for, I think, policymakers is are they going to be willing to spend more money to put these prisoners behind bars?
And that's the question that I asked the prosecutors. I think that really is the question that we have to ask ourselves as Arkansans. If our prosecutors are telling us that the people they're putting behind bars are violent offenders, are we willing to pay when we don't have enough room to house them?
All right, KATV's Janelle Lilley. We'll talk about this some more, right?
Yeah, absolutely.
All right, thank you so much. One of the leading supporters of prison and sentencing reform, who's been right knee-deep in the middle of it, is State Senator David Sanders. He's going to be our guest next. He's also one of the architects of the private option, now Arkansas Works. We're back right after this. Senator Tom Cotton says America has an under-incarceration problem. KATV's Janelle Lilley just explained what some of the data is telling us about Arkansas prisons. And this past week, we learned that insurance companies in Arkansas want to raise rates by 14 to 23%, although the governor and insurance commissioner plan to object. Joining me to talk politics is State Senator David Sanders. We're going to talk about all that stuff.
Policy.
We'll talk about policy and politics is what we'll do here. Sure. So they're all intertwined anyway.
That's right.
So welcome and good to see you, my friend.
Good to be back.
So let's talk about the prison statistics that we saw earlier there. It looks like fewer than 500 prisoners in Arkansas's prison system are nonviolent drug offenders. If you just look at the statistics from BLR, the Bureau of Legislative Research. What are lawmakers going to do about this?
Well, it's the great myth. So the myth is that our prisons are overrun and overcrowded, busting at the seams with people who really shouldn't be there. They're there because they were walking on the streets with a joint or something, maybe a little dime bag. And it's simply fiction. It's false. It's always been false. It's a compelling narrative. You look at what's happening at the national level. You have some conservatives, for whatever reason, who've decided they want to empty out the prisons, I guess, so states can cut taxes more, I suppose. And then there are some on the left who want to do the same thing because they have goals, I guess, with social justice. But when you get past the 500 that you talk about, well, there's another 17, well, there's a total of just over 17,000 people in prison. So, and those are hardened, violent criminals, most of them, people who are dangerous.
So it would suggest to me that sentencing reform is not going to ease prison overcrowding. So do you have to build new prisons?
Well, I think what you have to do is, one, make sure that, well, sentencing reform is part of it, but I also think truth in sentencing should be part of it too, because we want to put away the folks who are violent. We want to put away the folks who are dangerous. Rewriting the sentencing guidelines, coming out with something that will make everyone feel good, but ultimately is going to reduce more violent people from prison, that's a bad thing. And I think that's sort of the track. A lot of these groups, Council for State Governments, the Pew Foundation, the Right on Crime crew out of Texas, they're the ones that push for this. So yeah, we have a capacity issue in that we probably do need to build some more prisons. Maybe not a prison like was being talked about a couple years ago.
Right, where you had a $50, $60, $80 million price tag.
Right, because in order for the state to take care of someone, you're talking about $68 to $72 a day. But one of the things that we passed in the last regular session was we gave the governor the ability to contract with counties for regional correctional facilities. And the cost per day, per inmate, is half of what it takes to take care of an inmate with the Arkansas Department of Correction.
That's the direction that you think the legislature should go. Do you think that the political will is
there? It's my bill, the governor signed it, and it's the right thing to do. There are a number of counties that are very interested in this concept. And I think if you think about it for just a second, if you think what we want to do is take people out of a more expensive facility and put them in a less expensive facility in terms of what it costs per day, I mean, you're getting half. So there's an arbitrage that begins to develop. So good, look, guess what's happening? Arkansas's, the economy is picking up. Unemployment's at all these lows. We're doing all these things right. People are gonna move here, right? More people, probably gonna be some more crime. So we're going to need to increase that number. And I think this is a mechanism that will allow us to do it.
The other thing that we learned from some of the statistics that are out there is that they're not serving complete sentences, which has not happened for a long, long time. But do you think there's going to be a push by legislators to make that happen, to make those longer terms be served?
No, we need truth in sentencing. Let me give you a very real example. I think it's real to your viewers and a lot of us here in Central Arkansas. We just had Jeffrey Clifton, the father of Malik Drummond, who was sentenced to 40 years in prison. Well, let me tell you what's sad about that. He pled to 30 years of second-degree murder. And then he got 10 years for dismemberment or abuse of a corpse. He dismembered his son. It was a cold-blooded murder, and we know that. The truth is, Mr. Clifton will probably serve about 6 years in an Arkansas prison, and then he'll be out on parole. Now, that's why we need truth in sentencing, because I'm not sure if the general public and the citizens of White County knew that Mr. Clifton is not going to serve much time at all for what was clearly a heinous act, murder. I mean, one of the most, it's bad. So that happens on a number of violent offenses in the state where inmates are actually going to serve the absolute minimum. I don't think juries realize this when they sentence them. They think they're going to serve a lot of that time, and they don't.
But do legislators understand that it is going to cost more money to do what you're talking about doing, and will they step up to the plate and spend that money?
I think so. Again, when you look at a situation where there's an arbitrage where you can begin to transition to a system that on a per inmate per diem cost, it costs half. There's a way to do it, and there's a way to do it that will mitigate the increased cost, but there's a way to do it that, first and foremost, our first responsibility is public safety, and we have a way to do it in a cost-effective manner.
Let's shift gears and talk health insurance here. You're one of the architects of the private option, now known as Arkansas Works. You're a leading thinker in terms of health insurance reform. We've seen the rates come out, the recommended rates come out. The insurance commissioner has not signed off on those.
What the insurance companies have asked for.
Correct. 14 to 23% increases. Yeah. Does this surprise you that these increases, and why do you think that the increases are as large as they are?
No.
The request.
Well, one, if you look at it, with sort of the history of the past few years. I think what the insurance companies initially wanted and asked for for 2014 and for 2015 and for 2016, it wasn't really, that's not what they ended up with. I think they wanted double-digit increases in year 2, and they ended up getting Blue Cross Blue Shield got a 2% increase. Look, this is the start of a regulatory process. That's a regulatory negotiation. It's a process where questions that are unanswered are answered, where there is a lack of clarity is brought about because you have the actuaries from the insurance companies and the insurance department. They'll come together.
What do you expect to happen?
They're not going to get that rate of increase, but it's not going to be because I say so or anyone else says so. It's going to be because the process worked, and I think what we'll see is maybe a moderate increase.
All right, Senator David Sanders, always good to visit with you, my friend.
Good to be with
Appreciate you. That's all for this week's edition of Talk Business and Politics. As always, we appreciate you watching. Have a busy and productive week. We'll see you next time.